Kati Morton. I have a lot to say. I don't think a lot of people are going to like what I have to say, but let me first say that Kati Morton can handle her own. She can speak for herself. I'm not speaking for her. I don't know Kati Morton. I've never met Kati Morton. I've commented, I've watched tons of her videos and I've commented on things and I've tweeted her and here and there I've interacted with her and she's liked things of mine that were directed towards her, like anybody would like something that was positively said about them. So that's the extent of me and Kati Morton, just to put that out in the air. Kati is an adult woman. She can handle herself, and I'm not speaking for her when I say any of this. This is my reaction to what's been going on since the Shane Dawson documentary started. Just briefly to catch up anybody who hasn't been watching Inside the Mind of Jake Paul by Shane Dawson. It's about Jake Paul, YouTuber who's done a lot of crazy things, and Shane has been kind of saying, like, is he a sociopath? And he invited Kati in to talk and sit down on the couch, and in, I believe, Kati's home or hotel room or who knows, we don't know. But it was a relaxed setting and they discussed sociopaths and antisocial personality disorder and kind of like implied that YouTubers might have some of these characteristics or Jake Paul might. And ever since then, I was trying to really not say very much about it. If you watch my reactions to Inside the Mind of Jake Paul, you'll see every now and then in some of the videos I mentioned, like, well, I was okay with the way that Kati did things, and I explain why. But I was trying not to get involved in this because I didn't really think it was that big of a deal. But everybody seems to be making a comment about it, and since mental health is kind of my jam, and I really do like Kati Morton and everything she's done, I think she's a very hard worker and she's contributed a lot to mental health on YouTube, I'm pissed off. So I think the first thing that we really need to clarify here for anybody who doesn't know this, Jake Paul knew what this series was going to be about. He knew that it was going to be about questioning if he was a sociopath or not. I do know that there was a tweet that he put out where he was like, it's a little questionable the way that you're presenting this, but he knew that was the premise of what was going to happen. So it's not like they just like decided, let's diagnose somebody, which they weren't even diagnosing anybody anyway. Okay, but the big thing that seems to be pissing everybody off, and now I'm pissed off about it, and I really feel like a lot of you need to apologize to Logan Paul. I'm sorry, because if you had the reaction to that video that he did in the suicide forest in Japan when he filmed a dead body and you were like, that's disgusting. He's disgusting. What a horrible person. He's evil. And you started throwing all this stuff out about him. What do you think Kati Morton did when she said that antisocial behavior is gross and icky and makes her feel disgusting? It's the same thing. Why is it okay for you to say it about Logan Paul and it's not okay for Kati Morton to say it about any generalized antisocial behavior? Now I can already hear some of you. Are you saying that Logan Paul has antisocial personality disorder? No, I'm not saying that. I'm saying that the behavior is, it's the same thing as what you use to diagnose antisocial personality disorder. And the behavior is disgusting. I think it's appropriate to say what Logan Paul is disgusting and icky and makes me feel gross and I don't want any part of it and I don't want that in my life. And I think it's also appropriate for Kati Morton to say anybody who does those kinds of things, manipulating, lying, deceit, doing things that are not recognizing the humanity in people, that's a disgusting behavior. It just is. Nowhere did I see Kati Morton or Shane Dawson say that sociopaths or antisocial personality disorder or anybody with these problems are disgusting themselves. They were calling out the behavior. That is appropriate. And even Logan Paul has said that he has some antisocial tendencies, and he mentioned that there's a spectrum, and I'm like, yes, thank you, Logan. I give Logan Paul props for saying, you know what, sometimes I do things that are a little bit fucked up, and they're a little bit disgusting, and they're a little bit crazy, and they're a little bit more than a normal human being should be doing. You know what? I already know. Like, I'm losing subscribers. I'm losing a lot of people here. I just don't care, because if you can't handle this kind of stuff, then how can you have a discussion about mental health? Why are you on YouTube? All right, then I heard a lot of people saying, well, a therapist shouldn't be talking this way. It really doesn't matter if it's appropriate to say it or not. Like, it's not appropriate for a therapist to ever say this. Why not? Why is it not appropriate for a therapist to call bad behavior bad behavior? I have watched researchers talk about narcissistic personality disorder, antisocial personality disorder, borderline personality disorder, and I've watched them joke about it and laugh about how difficult the clients are and tell stories about clients that are pains in the asses, because you know what? People can be pains in the asses. I can be a pain in the ass, and if somebody wants to call me out for being a pain in the ass and tell me that's shitty behavior, that's appropriate. I don't see a problem with that. I don't see that as stigmatizing, to say that when you punch somebody in the face, that's a bad behavior. It's gross. It's disgusting. When you lie to somebody, when you manipulate somebody because you want something from them, like, that's gross. That's disgusting. That's what it is. Now, I do understand, especially with something like borderline personality disorder, there's been studies done, and we know that there are therapists who don't want to treat clients with the disorder because they find them so difficult. I do think that's a problem, but I don't think it's a problem to express that they're difficult. I think the problem is when you refuse to treat somebody because of the disorder that they have. Let's focus on that. Let's not focus on describing what's actually going on. You know, I've had a lot of characteristics of borderline personality disorder, antisocial personality disorder, narcissistic personality disorder in my life, and when I was having those things, when I was doing those bad behaviors, people should call me out for them. Like, I would have been fine with that. Maybe I'd be upset about myself and what I did, or maybe I'd be angry at the person or whatever, but we can't deny reality. We can't just be in denial and lying to ourselves and delusional about what's actually happening. Call it out for what it is. It's bad behavior. You know, I don't have a problem with people being honest about the way that life is, and I don't think that you should either. We shouldn't be babying people. I know that life is triggering. Okay, life is triggering. Life is triggering. I have had PTSD. I've had to deal with life triggers. I've had to deal with all the things that have set me. I've had to deal with people that hurt me. I've had to deal with all of that. But you know what? That's life. Life is not a clinical setting. Life is not a safe space. Life is not perfect and tailored to you and what you need. And if we're going to help people get better, we have to help them to adapt to life, not adapt life to them. Yes, I think it's important to have therapists. Yes, I think it's important to have treatments. Yes, I think it's important to help people to get to the point where they can adapt to life, but we don't bend our entire lives around people, especially not people who are harmful to others the way that antisocial personality disorder is. And I do know that there is a spectrum, and I do know that not everybody harms this is like one of those not everybody, not all, hashtag not all sociopaths. Like, watching this, I don't think it was ever meant to show that every sociopath is like this. They were talking about a specific kind of person because it was being dramatized. You know, I heard that PewDiePie did a video talking about this, and I was like, really? PewDiePie is one to talk? King of context doesn't matter. PewDiePie is going to talk about this? Really? Really? But I gave him the benefit of the doubt, and before I sat down to watch this, I watched his video, and finally at the end, he did say he felt like Katie took off her therapist hat and she just sat down with Shane to talk about this in the way that was going to work for the series. The series was meant to be dramatic. I know some people are uncomfortable with making mental disorders dramatic because they feel like it hurts somebody with a mental disorder. I personally am one of the people who feels like we need to talk about it. It really doesn't matter how we talk about it. I think we should correct for inaccuracies, but I don't feel like anything that Katie said was inaccurate. I know that that 1 in 25 figure is 4%, and I will link below to a study that says that the lifetime prevalence of antisocial personality disorder can be from 1 to 4%, and those are never perfect. And I understand that's a valid criticism, that she should have said it was 1 to 4% or whatever, but it was meant to be dramatic. And I feel like if you were watching this and you didn't understand the context, then learn the context. Go to Kati Morton's channel and find out, is this really who she is? Because if you went there, she made a video clarifying everything about what antisocial personality disorder is. This was not a clinical setting. They were sitting on a couch and it was being made for a dramatic reality kind of TV show, web series show, whatever you want to call this thing that we're watching. It was made to be dramatic, and I think that should be obvious to everybody watching. It wasn't like a serious sit down and she was presenting inaccuracies being serious. They were having a chat on a couch. I mean, for God's sake, they showed alcohol in the room, on the camera before they sat down. That was on purpose. It was to show you that this is just them having a crazy thing. I get so irritated that people aren't seeing this. Context does matter. Ask PewDiePie. Now, I know a lot of people had issues about, well, this is not really portraying antisocial personality disorder correctly, but yes, she was. Yes, she was. If you look at, I made a whole video yesterday about if I have antisocial personality disorder, and you know what? I'm not pulling out the DSM. You're smart enough to know what we say when we say antisocial personality disorder, and basically what we're talking about Yeah, of course, there's people who don't do criminal things. There's people who don't lie, or they resist it, or they just have the impulses. Like, I don't think that needs to be said in a series that's not meant to tackle that issue. Kati and Shane were talking about very specific behaviors, and they were describing them accurately. You know, I've done antisocial things in my life, and you know what? When I did those things, do you think I gave a damn what anybody else thought about me? Do you think I cared if somebody misrepresented me in a Shane Dawson video? I would have freaking laughed. I would have laughed at all of you making such a big deal about it. And do you know why? Because I didn't have remorse about the things that I did. I really didn't care what other people thought, and that's what Kati said, and that is accurate. When you have that mentality, you just don't care. And if you really want to get nitpicky about accuracy, the whole freaking DSM is garbage, because they sent out a work group to try to rework the personality disorders, and they decided not to go with the conclusions because they wanted to like play it safe and stay with the old version because that's what everybody was familiar with, which I think personally is bullshit. And you know what? The International Classification of Diseases, which is coming out with the 11th version, also decided it was bullshit, and they got rid of the personality disorder labels, which I am like so happy about, because these labels are garbage. They don't mean anything. Instead, ICD is looking at personality traits, specifically personality traits domains. And that makes a lot more sense to me. That's why we have so much comorbidity with personality disorders, because we're mixing all these traits together and trying to put them into these stupid categories that don't make any sense. We put them into these garbage categories because we have to please insurance companies and say, look, patient was exhibiting behavior A, B, and C, and now after treatment, they're no longer showing A, B, and C. It's such a stupid, boxed-in way of looking at a person, and I'm so glad the ICD is getting rid of it, and I wish all of us would stop with this craziness that everybody has to fit perfectly into some kind of disorder box. The whole idea of using labels in the first place is completely ridiculous and stupid, especially when we're talking about a personality. It's this black and white thinking. We know black and white thinking is bad. Anybody who's treated somebody knows, and not saying that I have, but anybody who's been around in life long enough, you know that nothing is black and white. Life is complicated. There are spectrums. This is why we keep hearing about spectrums and disorders, and there is no categorical way to look at everything. Something I always like to say is like, okay, when you get a cold, how many viruses do you need in the body before you can say you have a cold? Is it 1? Is it 10? Do you have to show symptoms? Okay, what symptoms? How much inflammation does there need to be? How many times do you need to cough? How many times do you need to sneeze? Does there need to be a combination of all of those? And this is why it's ridiculous to say that there's a threshold. You don't have a threshold for when somebody has a cold. You don't have a threshold for like all these other physical diseases. Maybe some of them, I don't know. But why are we making it so people... This is just like insanity to me. This takes the focus off getting people help, and it puts it on like making people fit into these rigid categories, and having a rigid sense of the world is something we see with something like obsessive compulsive personality disorder. It's a bad trait. Trying to fit people into boxes and trying to be perseverant and continue on with the way that things always have been. These are not adaptable things. These are not flexible. And why we persist on it is beyond me. Life is complicated, and the best we're probably going to be able to do when it comes to things like mental disorders, at least until we can get some neuroimaging, better ways of seeing the brain and how everything works, is to approximate what's going on and then treat based off of that approximation. And really, all we should care about is getting people help. When Kati says that she's around people with antisocial personality disorder and she sees the behaviors and she gets a feeling around them that they're icky and they're gross, that's countertransference. That is a thing that therapists learn about and experience, and it's normal to feel countertransference. It's normal to feel grossed out and icky and like slimy around somebody who is doing bad things to you. And that's important information both for a therapist but also for the client. Like, the client needs to know, like, when you stab me, like, that hurts, that sucks, stop doing that, you know? Like, just like parents teach their children, like, don't do that, it's not good. It's the same thing. Tiptoeing around it, walking on eggshells around it, only enables the person who's doing the bad thing and encourages them to keep doing it. All right, you know what? Lastly, I'm just going to talk about this whole idea that, like, Kati Morton's just a licensed family and marriage therapist or whatever, and that's not a real psychologist, and that's not real. Like, this idea, this is probably what got me making this video in the first place, because I think it is such freaking bullshit. Anybody who knows me and who watches my videos knows that I'm very cautious about the way that we talk about things like narcissistic personality disorder and antisocial personality disorder, and I'm always recommending and telling people you gotta go in and see somebody who is a licensed therapist. However, I also did a video about unlicensed YouTubers talking about mental health. A therapist does not get the final say in everything. And you know what? I don't think it's appropriate either to say, like, well, a therapist is less than a psychologist. And okay, but has a therapist actually personally experienced the thing that they're treating? Are they disqualified from being able to treat it if they haven't? What about a person who has experience? Does that person's experience not matter because they didn't go to school to learn about it? Like, everybody's freaking opinion matters. Why are you trying to qualify one person's better than the other? Everybody has something to contribute to the conversation here. It blows my mind that anybody would even be on YouTube and wanting to hear like different opinions about something and then try to like box it away and say, well, you can only listen to this person. What the hell is that? And for me, that kind of thought process actually stigmatizes mental health. I think when you baby people and you act like you can only listen to a certain kind of person and you can only treat a certain person a certain way and there's rules and all this shit, I feel like that is stigmatizing, because you're telling me that the person with the disorder is not capable of standing up for themselves and they're not capable of learning how to deal with this kind of thing. They are. Maybe right now they're not capable, but they can be. And I think it's such bullshit to act like they can't be and like they're not strong enough to deal with things when you don't know. You haven't even talked to the person, because this whole Kati Morton thing, we weren't even talking to anybody. This was just like a theoretical conversation about no one. If people believed with me and or if I believed, forget if other people believed, if I believed with my PTSD that I was never going to get better and I was never going to be able to handle things in life and like I was always just going to be triggered by everything, then why would not be able to do what I'm doing today? I would still be sitting like in a room freaking out like about going outside. I wouldn't be able to drive my car anywhere. It's ridiculous to me that we make mental health so taboo, and to me making it taboo like this is stigmatizing. I think it's important to be clear and have understanding, but at the same time, if we can't accept when people fudge things a little bit or things are a little bit weird or like we're not like we don't allow things like pop culture to make comments, I just feel like that's crap. I feel like that's crap, and we're doing a disservice to mental health as a whole when we stifle the conversation. We need more people talking. This is not the time to be like, no, don't talk about it that way. The only exception that I'll put to this is when we talk about suicide and we say committed suicide, because we know that saying this is stigmatizing. It's been shown. I think it's stigmatizing to act like everybody with a mental illness can't handle knowing that they have a mental illness and they can't handle life, because that's bullshit. We all know that people that have mental illnesses go to work. We know that people with mental illnesses have relationships. Of course they have difficulty, but they still live in life. And I think it's bullshit to say that we can never joke about it. I mean, people with people who are depressed are some of the funniest people in my life, because they make all these sarcastic, dark jokes that are just hilarious. And they make those jokes about their depression. And I know you could say, well, only somebody who has something should be joking about that something. But like, it's, again, context matters. I don't know, this whole thing just got under my skin. I was trying not to let it. I was trying not to comment on it, but I just saw so many reactions and so many people acting like this was such a freaking big deal that it just got to me. It got to me. And I don't like this whole idea that Katie's a horrible person for what well, you're calling her gross and icky. What gives you the right to call her gross and icky and disgusting? And I think it's bullshit to be like, well, Shane shouldn't be dramatizing this mental illness, because obviously, like, that was the whole idea. You know, I think of a movie like Split and I think, okay, that is stigmatizing. Or I think of 13 Reasons Why, and I don't like what they did there either, because of the way that they presented it. Shane never presented this. Shane presented this as a like funny thing, joking about whether or not Jake Paul was a sociopath. That was clear from the beginning, and the way that he was talking about it. I know that he like kind of mixed a little seriousness in with the funniness, because it was supposed to make us be like, weird, okay, that's kind of funny, I don't know, I kind of act like that sometimes, wait, am I a sociopath? Like, that was the point. And truthfully, the series isn't even over yet, and we don't know what conclusions are going to be drawn here, and like, I feel like people just like, why Why are we stifling the conversation? Why are we shutting people down before they've even had a chance to finish the thought? Why are we like micro dissecting these things and seeing everything in black and white? And why can't we just goddamn talk about mental health? I don't know. I don't know how to express these things that I'm trying to say. I hope that I've gotten at least some of it across. I hope that some people were willing to hear me out on this, because it's really irritating to me. I hate this idea that everything has to be black and white into a neat little box, and if you step outside those lines, then you're not credible and you shouldn't be speaking about this. It's bullshit. We're on YouTube because we want to hear everybody speak. There are plenty of people talking about mental health on YouTube that I do not agree with the things that they do. I do not agree with the things that they say, and I'm sure they feel the same way about me. But you know what? I still have subscribed to a lot of them. I still watch their stuff because I'm curious, because I want to, stay curious. I want to know what people have to think and what people have to say, and there could be something in there that's important, that's relevant, that I'm missing because I see things the way that I see them. And there's probably something important in the way that Shane is presenting sociopaths here, and maybe that's why you were bothered by it in the first place, because maybe you saw some of these things in yourself. I don't know, maybe not, but maybe you did, and maybe that's why you were like, wait a minute, I've stolen things before, I've treated somebody poorly before, I know that YouTuber, I like them, wait a minute, are they... Hello, we're all human beings. We all do these things sometimes. That's kind of the point. It helps us to look at ourselves and consider, what is our behavior? Is it acceptable? Is it maybe a little bit off? And then if you want the real answer, go sit down with the licensed therapist. Again, Katie wasn't sitting down with anybody. She was just giving you ideas, or she was giving Shane and the series ideas to start opening up the discussion on whether or not Jake Paul might be a sociopath. Jake Paul knew this entire time that this is what it was going to be about. I just don't understand the outrage and the frustration and the anger. So now that I'm done, have you concluded that I'm a sociopath? Are you unsubscribing? Let me know on your way out the door. Leave a comment. Don't make it nasty, because I do moderate my comments and I will delete it. I've done it in the past many times. I'm not afraid to. But if you got something constructive to add, please leave it below. I do think there were valid criticisms of what was going on. I do think that it could have been handled a little bit better. But overall, I'm fine with what Katie and Shane have done. I don't think either one of them needs to apologize. I actually think that they have over-apologized and over-corrected more than they need to. That's my opinion. What's your opinion? Let me know down below.